Hello, this is Tracy Carmack, and I am happy that all of you in Cyberland are joining me to cover this very important topic of the microbiome of children. So let me begin with a short introduction just to tell you a little bit about myself. My bacteriology degree was from Moscow, Idaho. My microbiology honors was from Glasgow, Scotland. My first job as a microbiology project manager was with Pharmacia Diagnostics in Stockholm, Sweden. I am a certified clinical nutritionist. I practiced as a traditional naturopath, and then I transitioned to nutraceutical sales. After 30 years in Texas, I moved to Idaho to be an organic farmer and rancher, and discovered that they spray the crops on 3 sides of our property 3 times with herbicides, and 8 out of 10 of my neighbors have cancer. I began looking into the soil microbiome for answers. I found microbiome labs. I have debated experts that have publicly said Roundup is so safe that you can coat your tongue with it. The forest behind our house is aerial sprayed with herbicide, and everyone I know around here has gut problems. When I go to trade shows, many of the practitioners that I help educate have gut problems, and so my creed is if I do nothing and say nothing, then I am part of the problem. So I am available to help those who want to be part of the solution. And what we have learned is a lot of the bad things in life as well as in the gut start with a D. So I call myself an educator of the DR program, where we discuss the problem, which is dysbiosis, lack of diversity, dysfunctional immune system, and destruction of the mucosal layers. And the solution is the R's, which is the restoration, the reinforcement, the rebuilding, the release of toxins, and that's what I'm hoping we can discuss in the question and answer session at the end of this lecture as it pertains to children. Okay, so let's get started. We once thought that the uterus and the whole birthing process in utero was sterile. We have learned that it is not, and that mom's gut bacteria in the cord blood and amniotic fluid has a lot of bacteria in it. So mom's dendritic cells, the phagocytic cells, will consume the mother's gut bacteria, carry them through the blood, and deliver them into the cord blood and amniotic fluid. Mother's vaginal bacteria can also travel upwards into the placenta. The placenta with low levels of lactobacillus are correlated with preterm births. Passing through the birth canal is the initial inoculation of the baby. So where do we get our microbiota? So what this is showing is that the vaginal secretions of the mother are going to make up the microbiome of the infant's mouth, skin, and gut. And after the first year, then father's microbiome starts showing up in these same areas for the infant. And then after has found its localized areas and becomes a unique fingerprint of the infant. But any diversion from this natural process will lead to disease. So again, that 838 days is 2.5 years. And at this days of age, we have acquired most of the strains that will make up our microbiome, and then a slight variation throughout the first 5 to 6 years of life. And the biggest changes in ratio of organisms you will see is when you start introducing solid foods around 4 to 6 months. But I want to emphasize the door is basically shut on what organisms are going to make up your unique microbiome at 838 days. What influences the inoculation? Of course, C-section babies will have higher concentration of Staphylococcus and Clostridia and less bifidobacteria and Bacteroides in the first few months. The Bacteroides is critical in development of the immune system. The bifidobacteria is critical in developing the immune system. The Bacteroides is important for training the immune system. And C-section babies have a higher propensity for food allergies, food intolerances, and autoimmune diseases. Remember that the gut barrier is permeable when they're born, and it slowly matures, but if anything interrupts that maturation process, they're going to have immune dysfunction. First bacteria for baby is mother's skin bacteria, hospital air bacteria, and doctor's bacteria. And this is all the inoculation is when they're C-section. Babies are inoculated with E. coli and Enterococcus. Both are facultative anaerobes. The bacteria start fermenting and consuming all the oxygen, which turns the gut into an anaerobic environment. Breastfeeding is the next big inoculation of the microbiome for the infant. And breast milk is extremely important. It's a perfect mammalian food. It contains over 200 different types of oligosaccharides. And these are specifically designed to feed Bifidobacter. And none of the oligosaccharides can be utilized by the baby. All function as prebiotic for Bifidobacter and Lactobacillus. The breast milk also contains lactoferrin, which starts helping to seal the gut and reduce inflammation. Lysosomes, that is an antibacterial component that ward off pathogens. Immunoglobulins that protect against pathogens. Cytokines to reduce the inflammation, and growth factors. Anaerobic Bifidobacteria, that means they cannot survive in oxygen. Low levels of this bacteria in babies is a risk factor for many health problems. Early proliferation of bifido in the baby's gut protects the gut from pathogens. Formula-fed children have more obesity, type 1 diabetes. The microbiome has an impact on genes as well. And they have increased Clostridia, type 2 diabetes, allergies, and asthma. It's important to increase Bacteroides early in life. Again, we said it trains the immune system. It improves development of the humoral immune system, which controls the Th1, Th2 balance. Better for the immune system, develop more immune tolerances, and can tolerate food, so they're not reacting to everything. Produces polysaccharide A to tighten up the tight junctions in the gut, more short-chain fatty acids, which feed the colonocytes, improves the barrier function of the gut, improves fat. Good food should be animal protein and animal fat, and that is not what new mothers are being told. They're being told to give grains, which is the worst thing to give an immature immune system. Where the organisms are according to pH, and this is covered in my SIBO lecture, but I said acid-loving organism, the Bacteroides, where the Faecalibacteria species. Here you'll see an intestinal lumen, toward the colon. You start with an acidic environment and you end with a slightly acidic environment as well. Now, the spectral disorders, or ASD, seem to show up around that 835th day, or 2.5 years to 3 years of life. And this is a result of the maturation of the microbiome was not performing properly because of the dysbiosis, because of the increased permeability. We know this because you can do a fecal transplant and have a total rescue from a spectral disorder, but eventually it reverts back to the unique fingerprint. Increased prevalence of Clostridia and Clostridia type increases the risk for developing spectral disorders. We already discussed how bottle feeding and C-section babies have higher rates of Clostridia, but also Clostridia will show up when you use antibiotics in the first year of life. Antibiotics wipe out everything, but they selectively they select for pathogens, so those grow back first. Glyphosate selectively inhibits good gut flora and promotes the bad, just like an antibiotic. So it has a function very similar to an antibiotic. If we look at the different species of the Clostridia that are involved, got Clostridium tetani, that's not present in non-ASD kids and produces a toxin that impacts the neurotransmitter release. Clostridium botulinum has shown to be significantly elevated in kids with ASD. A follow-up study with the same group showed 9 species of Clostridium present in the stool of ASD kids. Clostridium histolyticum is another toxin producing bacteria found in ASD kids. Okay, ASD and the microbiome. For years, research has focused on the brain and genes because of the way ASD kids behave. But we know that behavior comes from the gut. So the most updated science is clear that ASD is a multifactorial disorder. Both intrinsic and extrinsic factors have a role. We know environmental chemicals affect diet alterations and when the diet is introduced and what type of food is introduced, metabolic status, and very importantly, the most important is the state of the microbiota in the microbiome. Common correlations with GI disruptors and ASD development. Prenatal, perinatal, and childhood acetaminophen exposure have been associated with development of ASD. Coincidentally, acetaminophen has also been associated with GI problems, including acute upper GI emergencies. Exposure to antibiotics during pregnancy and in early life have been linked to later develop ASD, and some have suggested that early antibiotic exposure could cause ASD. Proton pump inhibitors, which are used to treat GERD, basically, a disorder not uncommonly associated with ASD, also affects GI pH levels and thus can cause dysbiosis. Pesticides and heavy metals that have been linked to ASD also cause mitochondrial dysfunction and GI abnormalities. ASD in the microbiome. Comorbidities with GI disturbance is often observed in ASD kids, estimates up to 70 to 90%. In human studies, the presence of the following other microbes besides Staph and Clostridia have been associated with ASD, and low bifidum and low akkermansia levels is huge. In most cases, the clinical severity of GI tissue were positively correlated with severity of ASD. A 2009 study showed that vancomycin treatment improved symptoms in children with ASD, but the effect was only transient, and when the drug was stopped, the symptoms came back. ASD kids tend to have higher levels of ammonia in the stools, and this affects brain function. Microbiome of the mouth could play a role. Mouth dysbiosis has been associated with the severity of epileptic seizures. One study suggests that vaginal dysbiosis from maternal stress may affect offspring and neurobehavioral development. So how does dysbiosis influence ASD? So what are the specific factors we know about? We know that by using the enteric nervous system and vagus nerve, microbes and their components can get direct access to the brain. Direct infection manipulates the vagus nerve. For instance, Campylobacter jejuni infections create sudden and rapid anxiety behavior by directly affecting the vagus nerve. Officer, I promise you it was my jejuni that made me speed. Release of bacterial metabolites. These can directly affect inflammation and function in the brain. For example, D-lactate and ammonia causes brain swelling. Suppression of serotonin and dopamine function. 2015 study showed that 95% of circulating serotonin is made in the gut. Dysbiosis can disrupt this biosynthesis. around 30% of patients with autism have abnormal blood levels of serotonin. Micronutrient deficiencies, especially B12. Methylated B12 is produced by a healthy gut microbiome and absorbed in the ileum. Dysbiosis reduces B12 production and absorption as well. Deficiencies impair formation of myelin sheath on the nerves, production of neurotransmitters, activation of genes, and repair of the gut lining. And vitamin D is also an example. And of course, leaky gut. Intestinal permeability and the association of blood-brain barrier permeability may play the largest role, yet in increasing risk and symptomology of ASD as it relates to the microbiome. If you have a leaky gut, you have a leaky brain. So there are several examples here of how the gut is in control of the behavior in the specific mechanisms. Now let's kind of hone in on ASD and leaky gut. So we've already talked about this 70 to 90%, but here's some specific studies showing that. All right, one line of evidence is the high-fat diet, which has been shown to cause a microbiome shift and increase intestinal permeability, which leads to higher concentration of endotoxins in the blood and more neural inflammation. This pathology is associated with increased ASD risk and symptomology. In our other lectures, we have discussed high fat, good fats, bad fats, and coconut oil. So I'll direct you to those studies, but in short, don't use coconut oil when you have a leaky gut. Going on a gluten-free and casein-free diet has shown promise in improving symptoms of ASD, as both gluten and casein have been shown to cause inflammation and gut permeability in a significant portion of the population. And again, this gets back to don't introduce these foods in an immature microbiome. Don't use, the reason most people are using gluten-free diets is to avoid the herbicide that's sprayed on them. And yeah, and if it's not organic, casein-free organic milk, it could have all sorts of other chemicals in it as well. So it's just a good idea to avoid any of these food, especially in the developmental years. In a Harvard study, altered intestinal permeability was found in 43% of autistic patients, but not found in any of the control subjects. Presence of toxin-producing harmful bacteria like Clostridium tetani seem to increase inflammation on the lining and increase permeability, maybe the mechanism by which these species are closely associated with ASD. Researchers studied maternal immune activation, used deliberate viral infection during pregnancy, showed that mice that were infected had leaky gut, and gave birth to mice that demonstrated autistic behavior. When they extracted the endotoxins from these mothers and injected it into normal mice, they developed autism symptoms. And this study with Patricia Efemia and her colleagues published a seminal paper on gut hyperpermeability, leaky gut, in relation to autism. The researchers reported that altered intestinal permeability in nearly 50% of her ASD participants compared to the controls. So we have the highest comorbidity with ASD and leaky gut. Autism is primarily a disorder of the brain, but research suggests that as many as 9 out of 10 individuals with the condition also suffer from gastrointestinal problems, such as inflammatory bowel disease and leaky gut. And that was a 2016 paper. So we know that leaky gut is most likely the culprit. It's ground zero of most health disorders in general. And we cover metabolic endotoxemia in depth in our other lectures as well. We also know that regular probiotics are not addressing the problem. And in the lecture called Myth Busting Probiotics, we cover all of the myths about how probiotics are supposed to work but don't. Because the current strategy of reseeding the gut does not work. What we're trying to do is recondition the gut by going back to the basics, using spores that were naturally found in the environment and in our ancestral diet were the primary organisms that were developing our immune system in our gut. So the proper way to use probiotic therapy with ASD is to use spores, and here's why. The ability to alter the host's immunity by increasing IgA and lowering inflammation. We know that the spores do that. They improve the mucosal immunity and reduce inflammatory markers. Restoration of normal commensal flora. We know that the spores shift the microbiome and increase diversity. Suppression of microbial pathogens. The spores have the capability to competitively exclude pathogens. Promote the synthesis of antioxidants with specific inclusion of Bacillus indicus in the probiotic mix. We do that as well. And then there's another one here. Improving the intestinal barrier and diversity, and we do that through the Total Gut Restoration Program, which is also covered in another lecture. So what's important at this point is to discuss how we change this protocol for children. Know that all of the microbiome lab products are appropriate for children, but in smaller doses. And technically you're dosing by weight, which is about a half a capsule for most infants or children. There are some ways to administer to breastfeeding infants by introducing it directly, just a pinch in the mouth or on the mother's nipple to be suckled by the baby. You can also break open the capsules and add for toddlers in their food or beverage. And it's not about, you can't overdose in the spores. What you're looking for is starting at a very small dose to look for intolerances, such as bloating or gas, or in an infant, crying to indicate that they have intestinal pain, and going slow enough to let the spores catch up and start reconditioning the gut. So what is happening is the lipopolysaccharide is being released from the cell walls of the gram-negative organisms that have overgrown and caused the dysbiosis. And when they die off, that LPS is released, and it has a series of die-off reactions that you want to look for and titrate slow enough that those reactions are not overwhelming. So I will go ahead and see if any questions. Okay. Feel free to contact me with any questions regarding this presentation, and I'm happy to address those and give me your feedback. With that, I will say goodbye and thank you for listening.